If you have ever thought about wanting to work from home as a remote nurse, you won't want to miss today's episode with our special guest, Sadie, the remote nurse. Welcome to the Stay at Home Nurse Podcast. I'm your host, Deanna Cooper Gillingham. For over 25 years, I've strived to use my nurse credentials to find work that fit my lifestyle. Whether it was raising my 4 children and 3 fur babies, traveling the world, or moving to Mexico and living on the Caribbean Sea. Sometimes I succeeded and sometimes I failed, but I always learned from the experience. Now, I want to help you by sharing what worked and what didn't work. There are so many opportunities out there for nurses today. The Stay at Home Nurse Podcast will inspire and equip you to have a nursing career that is meaningful and supports your lifestyle. Now let's get started. Hello, and welcome to today's issue of the Stay at Home Nurse Podcast. Today we have a special guest for you, Sadie from The Remote Nurse. Hi, Sadie.
Hi. How are you?
Welcome to the podcast. I've been wanting to have Sadie on for a while now because she does something really interesting. She helps nurses find remote nursing jobs.
Yep, I do.
So I'd love to hear the story of how you fell into that. But first, tell us a little bit about your nursing career. What did you do out of nursing school?
Well, right out of nursing school, I had a existential crisis, and I was like, uh-oh. I don't know if I really want to work on the floor. So I kind of was stuck for about 6 months deciding what I could do. And finally, I really wanted to get into like more public health or like a clinic setting or something like that. So I was looking into that, and I finally had found something with the health department. It was a care coordinator for like a pediatric special needs Medicaid program. And they poorly pay and everything. So they were hiring a bunch of nurses. So I got in there pretty easily. I was hired with about 4 or 5 other nurses, and basically just care coordination. It was in an office, but it wasn't like in a hospital. It was just more of like a telephone role, just managing the care for about like 200 kids who had lots of special needs. So I did that for a couple of years and I liked it, but then I didn't like it after a while. It was a little bit overwhelming for me. So then I got into clinical research, I think because they both had like the coordinator word in it. I was a clinical research coordinator after that. I think I had found that somehow on my job board listings. So I got that job. And then a couple of years into that, I had found out that there was a specific job you could do remotely that encompassed some of that role as a clinical research coordinator. So it was data abstraction. So I wanted to work from home. I'm like a total introvert, and my husband at the time was joining the military. So we didn't know where we were going to be every 3 years. And I wanted to start a family, and it was just a cascade of things. So I started looking into data abstraction jobs remotely, and like in my searches, I found so many different types of jobs that I also became interested in, because at that time, like my number one goal really was to work remotely. And I didn't really care what job it was. So that's why I had found so many different types and learned about all of them. But eventually I got a data abstraction job remotely. And then after a couple of years, I was just answering a bunch of Facebook group posts for nursing pages with people asking how to find remote jobs. And I would just kind of give my advice. But I kept doing that over and over, the same advice, like several times a week. So I just decided to make my own group. And over the past about year and a half, it's just exploded. Basically, I just share jobs to nurses that are remote opportunities, and just kind of introduce them to what's out there, the different types of job roles, like the realistic expectations of what remote nursing actually is and all that kind of stuff. So it kind of grew from that to where it is today, which is basically, the remote nurse. That's what it is.
So I find that really interesting because I know as a member of your group, I often see people say you can't get a job right out of nursing school that isn't in a hospital, but you got a job right out of nursing school that wasn't in a hospital.
Yeah, I was meaningful about that. That's what I was looking for, but it was a little bit harder. I did take a little bit more time to get a job, but they are out there. I think it's just a lot of people either think that they think that they can only do, you know, an inpatient job first, or that's really what the only kind of jobs they see for nurses. So they don't even know other things that exist. Or it's just like, you don't want to, if you do want to be clinical, you don't necessarily want to maybe go directly non-clinical right out of nursing school when you're like kind of fresh into that, and you can much easier like get into it at that point rather than doing a non-clinical job and then going back. So that's sometimes, if you do want to be clinical, it's probably best to go clinical right away. But yeah.
Yeah, I would definitely say that, because you have that clinical aspect of your nursing, nursing training, your school. And so at least some type of a background in that clinical, I kind of agree with you there. Like, if you want to ever do clinical, do it right out the gate. Yeah. And then move to something more remotely versus trying to do something remotely and then move back into clinical. Because I haven't worked in a hospital for over 8 years. And I think I would panic if you gave me a patient right now, because we don't know how to do all of those things. We still use our nursing skills as far as assessing but we're assessing differently. We're not doing a hands-on assessment. We're doing a different type of assessment. So we're still doing the nursing process, the ADPI, the assessing, and all of that, but we're doing it distantly.
Yeah.
Versus
like in a different way.
And we're yes. So we're still nurses. And I know some people think that we're not nurses because we're not putting our hands on a patient, but we're still using all of the knowledge we have. We're just using it in a different way. So a couple of things that I found really interesting. One was that you knew you didn't want to work in the bedside, but it kind of surprised me, because most people go to nursing school and that's all they teach you, really, is they teach you how to work at the bedside. Mm-hmm.
Yeah.
So when did you realize that wasn't what you wanted?
Probably my second semester of nursing school when clinical started. But no, I mean, I knew there were other options, and it wasn't like if I had to do clinical or inpatient that I would be completely miserable, because I know that even if I did that for a couple of years, I probably would have transitioned into something like this anyway. So it was more of like a long-term, like, okay, I may have to do stuff I don't like at first, but eventually I can go into a different type of role. Or even some inpatient roles didn't like utterly scare me, like labor and delivery or stuff, like different specialties, even like pulmonary and stuff wasn't as like intimidating to me. So there were certain things I could have gone into. But I think being in the hospital wasn't the best for me. And then we had like a school nursing rotation, which I really liked that a lot. And they told me mostly it was like LPNs and not always the RNs that were in those roles, but there were some that did that. So I was trying to kind of go that way. And that's how I kind of got into more of like the public health options that way. So I think probably now that I say that out loud, the school nursing clinical really is what catapulted me into be like, I don't have to work the bedside, do I? I might not make any money, but I don't have to go there.
Yeah, and that's interesting. That's interesting that you said like that opened your eyes to it, because we don't always realize all the opportunities that are out there, because in clinical and in the whole time we're going and getting trained for a nursing job, it's for an acute care usually, or public health, maybe depending on the school you go to. Also, I like how you keep reiterating that it wasn't the best money. So
yeah, there was a reason they were hiring 5 nurses.
Right. And that
a new grad was hired.
That's one of the things that I have found, that there are, I found 2 pools, and I want to see what you see out there, because you see a lot more of this than I do. But I found that there were places that were hiring you, and they're like, well, you're not working at the bedside and you're not working in a hospital, so we can pay you really low wages because you're not at the hospital. And then there's other companies that are out there that if you have the right experience and they feel like you actually need more experience and more training, because you are losing the hands-on in this, and you're losing your eyes basically when you're working remotely. So you have to be able to notice things that people are saying, read between the lines, and see what's really going on. And it takes a lot more critical thinking. And so they tend to hire people with more experience and pay them a lot better. So there's like 2 camps out there. So how is that what you're seeing when you're looking at these jobs?
Yeah.
Okay.
Yeah, it is. It's both from I think the company's perspective and the actual nurse's perspective of being like, if I don't have to work in the hospital, like I will make birth for money, which I don't really recommend doing that, but I mean, whatever floats your boat. And then, there's some roles that are like, you need the experience, or you need a certification, or you need like elevated skills, and they have to compensate you for that, because not every nurse has them. So even like case management, that's a very like unique skill that most of those jobs really want you to be a case manager before you go remote, because that is like a very specialized skill. It's not always something you can just like easily go from the bedside to doing remotely. You know, it's a skill you need to develop, and they pay for that.
You almost need to know I say you have to develop spidey senses. Like you have to know when something just isn't right, because you see things that like they're telling you one thing, but the results they're getting are another thing. And you have to figure out, and if you've seen enough, if you've had enough experiences, you can figure it out pretty quickly. Where if not, you're just blindsided and you're like, I don't know what's going on, you know? So it is one of those things. I always say case management is kind of like being a detective, because you have to kind of really, and you don't have your eyes, you're not seeing what's going on. You're only hearing what they're telling you, but you have to know when I was a remote case manager, I had to really rely very heavily on, what other things other than just, assessing the patient in the normal way.
Your intuition. Almost.
Yeah, your intuition would usually tell you. And it's the tone of voice. It's the way they avoid certain questions. It's the way they answer the questions. And you have to know what questions to ask. You can't ask yes or no questions, So it's a little bit different. Yeah. But so as far as pay goes, I think I was okay with going from a higher paying job to a lower paying job in a temporary measure. Like I knew to get that remote experience, I was okay with a slight pay cut, but I knew I didn't want to stay there forever. And are you seeing that people who have remote experience are able to get the better jobs faster, or is that not really a correlation?
I would say if you have remote experience as a nurse, you probably have experience in some type of remote job title, which to me, I think having experience in the actual job role is a lot more important than just like having worked remotely before. So like if you're a remote case manager, then what they're really most interested in probably is that you've been a case manager and not that you've worked remotely. You know what I mean?
Okay.
So I would say yes, because I mean, if you've worked remote, then you probably have one of those job titles under your belt. But I would say probably focus more on the job title and finding out what kind of job title you want, and then trying to get that experience somewhere, whether it's remotely or in your hospital or something. And that seems to be what helps get you remote quicker than other routes. Okay. Or just blindly applying to things that you're not qualified for at all, which I mean, you surely can, but yeah, the job role thing I think is the most important.
So when you started your search, being that you had no experience in a hospital, were you very strategic in what you were looking for, or were you just like, I'll take anything as long as it's remote? Which camp were you in?
Well, both. Okay. But I also didn't have all the time on my hands to apply to everything. So I mostly tried to hone in on stuff that I think I could be like slightly qualified for. So the data abstraction, obviously I was pretty qualified for, because it was almost probably 30 to 40% of my other job that's what I did. But even things like triage I probably could have qualified for, because I was a care coordinator and we did take triage of other people's patients. It wasn't like, calling into your doctor's office type of triage, but it was triaging people's cases. So I probably could have done that, or even some utilization. I mean, I guess some care coordination and then reaching on to case management, possibly just having like that similar. But yeah, I mostly focused on things that I thought I could at least be semi-qualified for, to be honest, because it's really competitive. So sometimes it's like it's like kind of hard to imagine out of, 500 nurses who have applied, if I'm not qualified in any way, like, of course I'm going to get passed up. So I tried to focus more on the things that I would be somebody that they would actually need, or want, rather than just like me wanting them.
Okay. So you brought up a really good point, and that's how competitive these are. I think, years ago, they weren't quite as competitive because nurses didn't know that it was even an option. Mm-hmm. And I'm finding that as the word is getting out that it's an option, that now there's more and more nurses applying for these jobs, which makes it much more competitive. I know I spoke with one of my my managers, and she said for every job that they put out there, they don't want to put it on the job board because they're going to get 500 people that apply for it. And that's just a nightmare for them to go through 500 applications. So they, if they do have to put it out there, they close it very quickly. So it's like it's up and it's down as quickly as they can get it, just because if not, they'd have 1,000 applicants. Yeah. So how? Okay, so other than just being on like Indeed or LinkedIn or something like that constantly and looking for jobs, how can a nurse find a job? Because obviously we work and we have lives and we have children and we have other things that we want to do than just sitting there waiting for, to go through and try to find all these jobs. So how would you recommend somebody get started?
Well, of course, I would recommend to go on the remotenurse.com just because I've created this job board. And basically, I just collect all these jobs from all around the internet. And I've formed some relationships with some of the companies to try to get more like clear info, because some of these listings are very vague. You don't know where you need to be or what kind of license you need or whatever. So my job board, basically, I collect these and I tag them with like the license you need, the states you need to be in, different specialties that they are hiring for. So like if a job posting says case manager, and then the content of the posting says like, oh, it's a renal case management or transplant, like I'll add that to the listing. So, like if you're a transplant nurse and you've entered that into the search, like that's going to come up for you. So it just kind of fine tunes the search process a lot more than going on Indeed, which I go on Indeed every day and it is a mess because there's just so many postings. It's so hard to find stuff if you don't have like specified searches and stuff.
So you learned a lot in your couple years of doing this to where you know what keywords to put in, how to find the remote, because some people call them remote, some people call them, and there's a lot of different names for these jobs. And so you've kind of figured out how to find them all and then how to categorize them all into, are they for nurses? Are they for RNs? Are they for LPNs? Are they for advanced practice nurses? Like who are they looking for? So because one of the things that I have found is the people who put the listing have no idea what we do. They're the same person who's writing a listing for the janitor and the same person that's writing the listing for the unit clerk and the secretary and the chaplain. So they don't know that an ICU nurse is not the same as a labor and delivery nurse, is not the same as a med-surg nurse. They don't understand that. And so I love what you're saying about how you're actually kind of telling them, hey, this is a little bit different. What kind of nursing experience do they need to have? And letting them know that we're not all the same.
And especially like the licenses and the locations, like I would say at least half of the jobs on there have no specification of where you need to live or like what state license you need. They'll just say an RN license. And then the location is tagged to like the headquarters of that company. So if they're based in Tennessee, then you're thinking, okay, is this only for Tennessee or is that just the company? Like, can I work anywhere? They never specify that. So one thing, like I can kind of read the listings now and kind of get what they're saying based on what their other listings I've seen, like probably thousands now of listings I've read. I can kind of group them together. Also, I see the same companies over and over, so I know I can remember, or I have a log of like what states they're actually in that they've said in other listings. And I have a lot of LinkedIn connections there where I'll just shoot them a message and say, hey, who is this for? Like, who can I tag this for? Because I don't know. So that, it really helps. So if you're like, let's say you're like a nurse or you're an LPN from Florida and you have like case management experience in transplant or whatever, you can go on my website and just put in a little checkbox that says LPN Florida. If you have a compact license, you can select compact as well, and then just say case management transplant. And it's basically going to give you a list of things that match pretty much that criteria. So you'll see things that match transplant, but maybe not necessarily case management, or case management not transplant. And it'll just only show you things that are for RNs in Florida or a compact license. So that's what makes it a lot less time consuming than going on Indeed and going through that,
and
because it is
through.
just a mess.
Yes.
Like if you just type in remote nurse, like good luck. There's like 40,000 results and they're irrelevant.
Yes. And I've done that before. And you're right, because it doesn't tell you what state that you have to be in. And it doesn't tell you, a lot of times it was just like, oh my gosh, it's going to take me an hour just to find. You would just click and click and click and click and click and finally find one like, oh, here's one I can apply for. So you're wasting a lot of time. And by that time, you're just so tired. You're like, I don't even know if I want to do the same.
Yeah. And I get a lot of my postings, or at least my leads, from Indeed, but I also try to do different things like on LinkedIn, since I am friends with like the companies and some of the recruiters and stuff. They'll post on LinkedIn. And then all different ZipRecruiter and all these Google Jobs and all these stuff I'm subscribed to. So it just gives you like a larger breadth, I guess, of options than just Indeed. And also because Indeed is so popular, like that's where a lot of people are applying and finding jobs anyway. So there's a lot of competition on Indeed as well.
So you go to the more obscure places so that you can have a better mixture. And
yeah. And I save like some of the company's direct career pages, and I have searches on their specific pages based on the words like some of them use telework, whereas like no one else uses the word telework. Only this company does. So I make a search that says like telework nurse or RN or LPN or whatever. And then I check those periodically.
Yeah. And so one of them uses telecommute. Like I remember one of them used telecommute. Yeah. And I'm like, nobody searches telecommute. So yeah. So you figure out what their terminology is and how they word it, and you figure it out. I love that. So people can go tell us the URL of your website.
Okay. It is theremotenurse.com. And then on there you can find everything. You can find the job board. The front page has, jobs, a start here resource if you don't know what you're doing, like nobody does initially. And then it just takes you to all our resources that we have. We have a membership group where I share some of these jobs early to the members, and then those get held for about a week privately, and then they get shared to the rest of the community. So the membership kind of gets you time to like have those sacred to you a little bit before the masses find them. Beyond also like, it just helps you kind of get in there first. And also you don't have to actually go searching for anything. So that's always a plus as well, because nobody wants to do that.
So let's focus on that for a minute. So if you are one of your early alert jobs membership nurses, what exactly do you get? So you told us you get a week before. Do they have to log in and find these, or do you send them an email? How do they know that these jobs are out there?
Yeah, so it's like a membership portal. I have a document that I update daily, but I also send a daily email alert because I'm a nurse as well. And I know that I'm not going to log into a website every day. So I need it to my email. So I send it every weekday. And it's probably about 10 to 15 jobs that I find each day that I link to my website, but the actual link itself is private. It's password protected for the members. And nobody on the actual public website can even find it at all. Anyway, so that's helpful. They get it directly to their inbox. And then those specific jobs get held for a week. So I don't share those out to my community for another week to give you just some time to apply. And again, you don't have to really go searching a lot, because any jobs that get posted on my website are first posted to the members. So it's not like you're going to miss some on the website that you didn't see or whatever. You're getting them all just early. So that really helps.
Which you're kind of making it easy for them, because instead of them going through every day and saying, is there anything new that I'm looking for? I'm looking for a data abstraction in this state. They're going to get that email every day and say, oh, there's one. And then the next day say, oh, there's nothing today. There's nothing today. Oh, there's another one. I'm going to go on the website. So you're kind of saving time is basically what you're doing. You're saving them the time and the effort of having to go to the website and do the search, even though you've already done a lot of the work for them by putting it on your website. Now you're even doing more work for them by sending it to them every day. So they don't even have to go to the website. How nice is that? Yeah.
Yeah. And holding it kind of secure for them. Yeah.
And I think we need to clarify something too. Your website for most people is free. Anybody can go there and use the website and find all of these remote jobs. If they want early access to the jobs,
Yep.
they pay the membership.
Yeah. So,
and it's a monthly membership?
Yep. It's monthly. You can cancel anytime. I did that just because if you find a job, like, why you don't need to be in it anymore. So yeah, it's monthly. And basically every weekday, Monday through Friday, you get 10 to 12 jobs that I find everywhere or get sent to my inbox or somebody messages me or whatever. So yeah, I think the biggest perk of that is just like not having to search, because even if you go on my website and search, you still have to remember to do that every day. You still have to be like, okay, well, what did I see yesterday that I didn't apply to today, or whatever. You have to be the one that prompts yourself to go do these things, which nobody does. Like we don't do that more than like 20% of the time. So just getting these to your email and knowing that you have a week also is like a really big perk, because obviously a lot of nurses work 3 days in a row, or, they see it at their lunch break and they don't have their resume done ready for them to go. So it's like, okay, I saw that. I really want that job, but at least I have time to go tonight or even this weekend or whatever before a lot of the other people get to it. And a lot of the jobs actually close within a week. So that's another perk. I would say only about 50% of the jobs that I share to the early members ever make it to the public job board because they're closed by the time.
Wow.
Because these jobs obviously go so quick. So that's another reason you might want to do that.
So that's another perk. Yeah. And I love how you, like I said, sending it every day. Then if I work 3 days in a row, I can go back and look at the last 3 days worth of emails, see all the new listings that are up there, apply for the ones. I think we need to kind of focus on another thing though, too, is how do you even know what jobs are there that you might be qualified for? How do you know what the pays are? Mm-hmm. When you're a new nurse starting off and you haven't been making anything, something is better than nothing. So you're like, yeah, I'll take that,
right.
$5 an hour job. No, not $5, but you know what I mean? You'll take just about anything because it's better than nothing. But then if you've already been working and you've been making some good money, it can be hard to go down. So do these jobs list the pays or no?
Mostly not, honestly. Some of them do, but most of them don't list it.
Okay.
Yeah, it's kind of hit or miss. There's a general, for each kind of job role, there's a general range. Like for case management, what I've seen going into it, maybe as somebody who hasn't had case management experience, I would say maybe like you could do 60 to 70 grand. And then as you gain experience, or if you already have experience, it can go up from that. So I think case management and utilization management are the better paying ones. Some people that's their main thing that they need. So that's what I would recommend. And then some of the others do have lower wages. Like some of the triage jobs can pay a little bit lower. And another thing with that is that a lot of those are either part-time or PRN or contract jobs. So you do get like a lot more flexibility and stuff. You're not tied down 8 to 5, but also like you do have a nursing credential that deserves like adequate pay. So I wouldn't recommend taking too much, farther below your income. But also I know for me, going remote was really valuable to me. So I was willing, like you said, to cut my pay a little bit if I had to, just to get that lifestyle and that freedom. But I would be wary of some of the jobs that pay you dirt because some of them I've heard of, like online education that require a DNP and they pay you $17 an hour. I'm like, okay, no. No.
Yeah, that's one of my, I was actually going to do an episode on that, just about, I've had people say, well, I want to work as a remote. I want to teach for a college remotely, so I'm going to get my DNP. But then they don't realize that they pay $17 an hour.
Yeah.
And it's part-time. And it's like, okay, so you're going to spend how much money to get a degree so you can make less money?
Yeah. And a lot of those jobs require a lot of teaching experience as well.
A lot. Yes. A lot. Yeah. Yes. So it's, you have learned a lot through not only your own experience, but the experience of the members of your group and the people that you've helped to get jobs for. And I'm sure that you get the same questions over and over and over. So do you have an easy way to answer all of these questions that you get? First of all, what are some of the frequent questions you get? And then how would people get these questions answered?
We get a lot of the same questions. Most of them are related to, like I have XYZ experience. What type of job should I find? So a lot of people aren't even clear on what kind of jobs are available, and so what they should look for or what they're qualified for. So that's probably the most frequent question. And then we also get questions about like working from home with kids. If you can keep your kids home, that's like a very really popular question. If there's jobs for LPNs, which yes. And there's a bunch of different questions. How like the state licensing works, like how can a nurse in Georgia work for a company in Florida and stuff like that. That's a little bit complicated sometimes. So a lot of those questions basically any question that you have has been asked many times and I've answered it many times. But yeah, and one resource I always like to start with, the free resource, is our Facebook group, Remote Nursing Jobs. Lots of questions are always asked on there, and you're free to always ask whatever question you want as long as it's appropriate. And a lot of people will help you with little tidbits and like, this is my experience, look here, or whatever. And occasionally I'll answer some of those as well. But more recently I'm doing some consulting, but it would be email consults where you basically tell me what your credentials are, where's your location, what specialty experience you have or are getting or want to get. And just a bunch of little questions that help me fine tune kind of like a personalized report for you to tell you what kind of jobs you would fit best, like the quickest, rather than, 10 years down the road, I can work in this job. But like based on your experience, where you live, what license you have, these are probably the best types of jobs that you can get quicker than others. And then just some companies to look into, like there's a lot of like labor and delivery or maternity nurses that have no idea where they're even looking. So I have some companies that I specifically look for that offer those types of remote roles. So basically I would just give you like a personalized report that is specific to you. So you don't have to sift through like, okay, this is irrelevant. I have no home health experience, so why am I getting home health, recommendations? So it's just very helpful to cut through all that instead of searching for hours on the internet or in my group. It's just like, hey, here's my experience. What should I do? Here's your report and here's your links, and have fun, so it's a lot more time efficient. And yeah.
For somebody who doesn't want to wait 3 months to try to figure this all out and just wants the fast path, you offer that option for them.
Yeah.
And that's your email consults?
Yep, that's email consults. That's coming out soon, or depending when this comes out, it might be out currently.
It should be in 2 weeks, 2 Fridays.
Okay, yes, it'll be out then. Okay. So that'll be on my website too, as well, thereemotenurse.com. You can see that.
Now, I know me. I used to be the person that used to like to research everything, and now I have no time to research anything. So if I didn't want to go to the Facebook group, or I know I get a lot of people that email me and say, I'm not on Facebook, what should I do? So for somebody who's not on Facebook, or who doesn't want to just go and sift through tons of posts and wait for answers, and they just want all the information right now about everything you need to know to get started looking for a job as a remote nurse, where would they go? What would they do?
Go to theremotenurse.com, and I have the easiest way to get that on demand right now is through our crash course. We have a remote nursing jobs crash course, and that will basically answer all the frequently asked questions we get and tell you 12 different types of jobs that are out there, including what those are all about. So like a description of what that is, how much patient interaction it has versus none, if that's what you want, what kind of like benefits they usually offer, pay ranges, all that kind of stuff, which will help you determine like, is this type of job right for me? And then should I start looking for those jobs now? Because you don't want to be going on Indeed and applying to everything if you realize, oh, actually, like, I need a full-time job. I can't be applying to all these like telephone after hours triage jobs. Like, I'm wasting my life. So that is a really good condensed resource to look. It's only about an hour and 15 minutes. And it really helps like speed up where your starting point will be. So you don't waste time on jobs that aren't fit for you, basically. So that's a great resource for that.
Okay. And that's really great that you did that, because I know going through the Facebook group, sometimes you would ask a question, either it gets answered by 100 people with very various opinions,
Yeah.
All right. So if you want to go directly to Sadie and get the facts, you can get that in her crash course, or you can go on the Facebook group, which it's a wonderful resource. But I always say, like, sometimes you have to like know who the person is that's answering the question too, because
and because these people are there to help, but nobody there knows exactly your scenario, or honestly, nobody there knows like all the stuff I know just from seeing all this happen on the back end. Like, there's just so many companies I know of, so many weird companies that you would never think exist, so many weird job roles. It's just like, there's so much in my head that needs to get out there, so.
Well, I'm glad that you finally got all this information in your head into a course and into your email consults and onto your job board so that you can make it easier for the rest of us. I remember when I was looking for something, I kept saying, and I'm not sure if I'm pronouncing it, is it HEDIS?
Uh-huh.
Yeah.
Well, that's how I say it. I hope so.
Okay. I kept seeing this, like, they were hiring for these remote HEDIS nurses. And I'm like, what is it? Like, at the bedside, I never had to do HEDIS and I didn't know what it was. And I would like do Google searches and nobody, like, it would just give me this random information and I had no idea. I'm like, how do I even know if I'm qualified? Because I don't even know what the word means. I guess I'm not. And so are these the type of things that you explain in your course? Like what these things are?
Yeah, not specifically HEDIS. That's a good idea. But certain job roles, like I'll decipher the confusion of what they are, what you actually do day to day, and what kind of nurses they hire for those. So what kind of experience they look for, like the triage, they always want like either primary care or like emergency or even pediatrics, hospice. Just, you might not know that off the top of your head, but just because I've seen it over and over again, it's like, okay, these are the types of nurses that should probably go for these types of jobs. So I do kind of break it down a little bit like that.
Yeah, because
maybe I should do a HEDIS.
I think you should. Yeah,
I did HEDIS. I was a HEDIS abstractor, so I do now.
And I think I learned from you that that's actually a season that they hire for.
Yeah,
it's
seasonal. Yep.
Yeah,
it's
so
like February to June or whatever.
So maybe around Christmas time, you need to start working on that and get that out there for the HEDIS season. Okay, awesome. Okay, we have talked about a lot, but I hope that we have opened the eyes to all of the awesome opportunities that are out there for nurses, because honestly, before I started working remotely, I did not know it was a thing. I thought the only thing you could do was work at a hospital, work at a school, or work in a doctor's office. And when I found out that you could actually work remotely, I was like, you've got to be kidding me. You can't do that with a nursing license. So one of my goals, yes, it's like, it just opened my eyes and I was like, oh, the possibilities, and it changes your life. It's not for everybody. And maybe we should close with something about that. It's not for everybody. I've talked to people who, after working remotely, wanted to go back to the hospital because they either missed the patient contact or they felt like they were isolated. You and I are introverts. I don't need to see anybody. So it doesn't bother me. But I have had people say that they just miss that nurses station talk and the camaraderie and all of that. And where I do miss it, I have had some of the best friendships with my nurses that I work night shift with, because you're sitting there for 12 hours and you get to know them so well. But that being said, a lot of people do miss that. So remote nursing is not for everybody. But if you think it's for you, you should probably go check out Sadie's website. And I'm going to let you give all that information one more time. And then we're going to put it in the show notes and on our website. So if anybody is looking for it, they can find it. So go ahead and give us one more plug for your Facebook group and your website and all your good stuff.
All right. The website is theremotenurse.com. And then basically on every social media platform, I'm the remote nurse, at the remote nurse, except Twitter, because I don't know how to work Twitter. But Facebook, Instagram, and LinkedIn, the remote nurse. And then on Facebook, our group is called Remote Nursing Jobs. And then there's also another group, Remote NP and PA Jobs, for nurse practitioners and physician assistants. But yeah,
awesome.
That's where it is. And I would say, it's not for everyone. If you really like patient interaction, you like people, you even if you don't really like the patient interaction, but you need like that work family, because a lot of people's like friendships are based on their work companions. So if that's important to you, I would consider if it's really right for you, or even just consider maybe a PRN job or keeping what you have at a PRN, and that way you get the best of both worlds.
That's actually some good advice. I like that. So you can still go out there and interact with your friends, but then you can work.
Yeah,
remotely.
but you don't have to burn out.
Yeah. Awesome. I love it. Okay, go check out Sadie's website and her Facebook group, and we will be back again next week with another awesome episode. What a great episode. I hope you've enjoyed listening as much as I've enjoyed recording it. Sadie is such a great guest with such great resources. Be sure to check out her website, The Remote Nurse, if you're interested in finding a remote position.